First of all, Congressman, thank you for giving us the opportunity, and aloha to you folks in Washington. My name is Hardy Spoehr. I'm with Lokahi, the Native Hawaiian Health Board. You may or may not be familiar with us. We do many of the things that the American Indian, the National Health Board does, only for Native Hawaiians, both here in Hawaii and across the continent. First of all, our board is very supportive of the legislation and the administration's effort to look at reforming health care. We do have some things that we thought would be strengthening as it relates to our constituency. Native Hawaiians, along with American Indian and Alaska Natives, have a special relationship with the United States, and it's conveyed in federal legislation through our respective Healthcare Improvement Acts, the American Indian Healthcare Improvement Act and the Native Hawaiian Healthcare Improvement Act. In those acts, too, there's discussion about the various special relationships as it relates to consultation and consultation issues. We feel that this bill could be strengthened if those consultation issues are clearly documented and defined within the legislation. Also, we feel that in terms of one of our major issues is around the area of prevention, obesity, some of those things, community health environments. One of the things that we would certainly support would be references to things such as school lunch programs, healthy school lunch programs, physical education programs, and things that really look at some of the prevention around obesity. The other area is around alternative and complementary healing, and in our case, we're particularly interested in traditional practices as it relates to our Native Hawaiian traditional practices around health and healing. And I'm sure our brothers and sisters in Indian country would feel the same way as it relates to their practices. And currently there's no discussion in the bill about traditional practices or alternative and complementary areas of healing. We'll be submitting a list of some of the other specifics as it relates to the administration's efforts, but I did want to convey that our board is very supportive of the work you're doing.
And we do definitely believe this has not come up very much because the other committees don't think about that necessarily. We absolutely have to have mandated in the whatever bill comes out that Native Alaskans, Native Americans, and Native Hawaiian programs have to be mandated in there. Otherwise, they're going to slip out the side. I can see it coming right now. It's going to slip off the board. And somebody's going to say, well, if it's not actually in there, then it's not going to come. It's just huge. We just cannot rely on the Department of Interior and say, oh, well, that's going to take care of everything with regard to Native issues, whether it's healing or programs or whatever it is. So I know that's a huge thing to have to take into account, but legislatively it cannot be missed, or you're going to find a huge disconnect and a dysfunction take place. And we can't leave anybody out.